Hello, my name is Kiana Dunn, and I'm going to share my patient with you. A 21-year-old Caucasian female with a birth date of 12/2/2002 comes to the clinic with her boyfriend. She is a reliable source to her medical history. She has a chief complaint of I am having burning with urination, vaginal itching, and thick off-white discharge. HPI. A 21-year-old female comes to the office complaining of burning with urination, thick off-white vaginal discharge, and some vaginal itching. She denies all other symptoms including bleeding, cramping, and or odor. She states that she does have some pain when touching the vaginal area. She also reports pain when the tip of the penis is inserted into the vaginal opening. Her symptoms started about 10 days ago, and she has not taken any types of medication to help with her symptoms. She reports that she has had 2 sexual partners in the last 90 days. She does voice that she was recently seen at the STI clinic at her local college, and she was tested for the following STIs, which were all negative: gonorrhea, trichomonas, chlamydia, and HIV. Past medical history, our last menstrual period was 11/10/23. Medication-wise, she takes Erin, a form of birth control pill. She takes 0.35 milligrams tablets by mouth every day. She has no allergies to food, medications, and our environment. She has no past surgical history. She has no pertinent family history. As far as her social history, she denies any type of marijuana use, illicit drug use, or smoking tobacco. She currently lives with her mom in a single family home. She denies being married. She currently has a boyfriend of 1 month. She graduated high school and is attending a local community college. She only has sex with men, and she is currently in a monogamous relationship. She does state that she currently is on her birth control pill, and she states that she only has vaginal intercourse, and she revealed that she had unprotected sex multiple times with her boyfriend. Spiritual-wise, she is a Christian and she attends church every Sunday. Safety-wise, she wears her seatbelt and she obeys all traffic laws. Review of systems, everything was unremarkable except for her genitourinary. She reported that she had some burning with urination, vaginal itching, and an off-white thick vaginal discharge that started 10 days ago. She does state that there is no odor and that she is experiencing some pain when the tip of the penis inserts into the vaginal area. As far as lymphatic, she denies any type of swelling in her inguinal area. Objective, her vital signs were all stable. Height 5'8", weight 140 pounds. She has a BMI of 21.3. We did some point of care testing in the office. We did a urine dipstick, and her urine pH was 5.0. The dipstick showed no leukocytes, no nitrates, no blood, no protein, and or no glucose. We also did a urine pregnancy test, which was negative. We also did a saline wet mount. No Klucel type bacteria were visualized. We also completed a whiff test. There was no fishy type odor detected. We also did a potassium chloride wet mount, and there was some yeast buds with hyphae seen on the slide. Currently, she is alert and oriented to person, place, and time and situation, and she appears to be in no acute distress. She is well nourished and well groomed. Respiratory, her lungs are clear in all bases. Her chest wall is symmetrical and expands equally on inspiration and expiration. Her cardiovascular, her heart rate is 70 and regular. No gallops or murmurs noted. Gastrointestinal, upon abdominal assessment, there was no pain or tenderness noted upon palpation. No nodules and or masses noted. Genitourinary, there was a scant amount of off-white vaginal discharge, along with some erythema and some irritation to the vaginal walls. There were no lesions or ulcers seen. Assessment. No further lab testing needed at this time. Differential diagnosis. We diagnosed 1, vulvovaginal candidiasis, which is also a yeast infection. 2, bacteria vaginosis. 3, cystitis. 4, allergic reactions to irritants. Her primary diagnosis on this visit is vulvovaginal candidiasis, and the explanation for that is based off of the potassium chloride wet mount. There were yeast buds with hyphae seen. She also has some symptoms to include a white, thick vaginal discharge along with some burning. Her burning is related to secretions actually hitting the vaginal wall and not related to any type of urinary tract burning. I was able to rule out bacteria vaginosis as she had a negative whiff test and no clue cells were seen on a saline wet mount. I also was able to rule out cystitis as her current symptoms don't pertain other than the urinary burning, as well as some of the vaginal discharge. But what ruled this out was the results of her urine dipstick were negative. I was able to rule out any type of allergic reactions to irritants, because usually when you have allergic reactions, you do have the erythema, but there isn't vaginal discharge present. We're going to treat her with fluconazole, 150 milligrams PO/Q day times 1 dose. We're going to dispense 1 tablet with no refills. We're also going to provide her with some condoms and educate the importance of using them to prevent pregnancy and other types of STIs. Educate the importance of refrain from having sex while taking the antibiotics. She's going to continue to take her birth control pills as directed. She may take the fluconazole on with food, as it does cause an upset stomach. She is going to be taking all medications as directed unless she feels she's having an allergic reaction, which she needs to call the clinic immediately. She's going to return to the office if her symptoms get worse, and she's going to report to the ER if she gets severe abdominal pain, pelvic pain, and develops a type of fever. This case was one of the most memorable experiences that I had, because I was actually able to build a rapport with this patient and gain the patient's trust and be able to provide her with the education that she needed to feel much comfortable with the diagnosis. As far as the Gene Watson curative factors, I used 1, instilling faith and hope. And I chose this one because I was able to help the patient maintain a positive perspective and have confidence during this recovery process of this illness. I was also able to maintain this by some good education regarding vulvovaginal candidiasis. I also used cultivating a trusting relationship. I was able to build a very good rapport with this patient. She actually was able to gain my trust, and the more that she trusted me, the more she opened up during the visit. And the more that she's seen me listening and documenting what she's saying, she even opened up even more. So by the end of the visit, we were actually able to form a trusting relationship. Thanks for listening.